Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Good morning, everybody, or afternoon if you're in a different time zone than we are.
We love celebrating members' wins in the program. So this week, I want to highlight they started the program at 77 out of 132, and in 3 months is down to 9, which is absolutely amazing. So congratulations. And then started the program at 61 out of 132 and is down to 5 in a year and a half. And I know they did take a few different breaks in there as well. So congratulations to both of those members. Otherwise, we can move to our first question, which is,
hi, everyone. It's been a while.
Hello.
So I am consistently getting these headaches from being on screen. This is, nothing new. It'll be almost 2 years in February. We have a little bit of time at this point since my concussion. What happens is I'm able to be on screen doing stuff on the computer for 2.5 hours, and then I need a decent break of 20 to 30 minutes. What happens though, and this happened yesterday, and every once in a while, I forget to track my time that I'm on screen, and I'm not paying attention to it. And it seems when I do that, if I surpass this 2.5 hours, I get pushed into this bout of fatigue. And so and it's sort of, I recover from the fatigue within maybe like an hour. And then, for example, that happened yesterday. And then today I woke up and I have this sort of like dull headache around my eyes. So I feel like it's like this hangover that I have. Now, I have been trying different chiropractors. I actually just found a new clinic that is specialized in chronic issues. They haven't worked with concussion patients, but they seem to really dig in, and there's an aspect of chiropractic care, acupuncture, physical therapy, etc., which often exists in most of these clinics, but for this one, they're really advertising that they have an individual plan for each person. So I'll check that out next week, which I'm excited about. But my question is, am I missing this piece, or should I be looking into something further in regards to this fatigue piece? For just a little bit of background there, I've been going to my naturopathic doctor for some time now, and I have low thyroid numbers, but she's had me on a supplement that I'm taking daily. And I really don't have an issue with it. Again, like until I push past this threshold that I seem to have. But I guess other than, and I probably, maybe I should tell you the supplement I'm taking. I can grab that from the counter. But I'm wondering if there is sort of this missing piece of the puzzle or something else that I should be looking at. It seems like I need deeper neck work, and the acupuncture piece I really haven't done. So I haven't done that with the neck work, and I feel like that could be transformational. But this fatigue part confuses me. So I'm just wondering if you have any suggestions for, additional testing or doctors I should see.
Okay, so I'll answer first, but I personally think this is more in Cam's area and wheelhouse, and I'll tell you why. If generally speaking, you don't have the fatigue and it really comes on only after you've kind of pushed through this threshold, is that correct? I just want to make sure we're understanding. The fatigue that's related to thyroid, fatigue that's related to adrenal function or iron deficiency or B12 deficiency, or even something like a chronic fatigue-like syndrome, that's present all the time. There's no threshold, so to speak, for that. You're going to feel fatigued much more often, not only after you use screens for set kind of threshold, and then anything past that brings fatigue. So I think that this has more to do with a fatigue that's related to your visual and therefore then your cognitive systems that's visually processing, rather than a thyroid or any other thing. So I don't so much think it's in the naturopathic realm as from what you've shared here.
Okay. I did have lower B12 numbers, and I've been taking that consistently, and I do get little bouts of, or we're like exhaustion. I mean, I am in that range, that age rate. Like I'm about to turn 44, so I'm in that age range of perimenopause. So I don't know if it has to do with if that has to do with some of the more tired feeling that I feel in general. I wouldn't call it fatigue though. I just get tired if I'm doing a lot in the day, like physical activity. So it is present in general, just not largely.
Right. The other piece that you could look at is any of the things that you've tried, whether it's the thyroid supplement or identifying suboptimal B12 and correcting that, or anything other deficiency. After you're doing the strategy to correct it, which usually is either a nutrient or a diet change or a medication in some rare examples, do you notice that you feel better after taking it? Or on the flip side, if you're taking it, do you notice that fatigue is much more pronounced if you don't take it? Like, for example, you miss your thyroid dose for a couple days, your thyroid supplement. Those are all key signs to tell us that that's the area that needs the issue. All the things that you've described, you're obviously trying to challenge yourself here and do more with things like screens and with things like work and cognitive load. This could totally be explained by that deep network that's required to identify, over a period of time, you have hit a threshold, but I think that's mainly on a structural level.
Okay.
So fatigue that you're experiencing with screens, like it could be due to like autonomic, right? Like just increased cognitive load. How's your exercise tolerance?
It's great. I do tons of weights and also cardio.
And you don't have any increase in symptoms. You can get to full exertion with no problem.
Yeah.
Good. Okay. Fun. Now the other part, like fatigue in these kind of like dull headache type situations, there's a few things. So one is like the screen flicker rate is a thing because it can be stimulating. So if you think about like autonomic on a spectrum, at the very kind of end of the spectrum, you have dysautonomia, which is like, even just standing up is going to be problematic for you. And then you have, next to that, you'll have moderate, which is like exercise intolerance. But even then you could have like kind of mild, which is more related to like, you just have some cognitive fatigue when you try to do a lot, like increased cognitive load. And particularly with screens,
usually the issue is related to the flicker rate of the screen. So screens are actually flashing at you repeatedly, and so that's like very stimulating. So it could be something with that where it's just like after a few hours, the stimulation of that screen flickering at you is just starting to kind of overload the system, and that's why you have that kind of like crash, right? Like it also has to do like with the autonomic system, and controlling blood flow to the brain and that type of thing is if it's not very efficient, you're gonna basically be burning a lot of energy as you're trying to do cognitive tasks. So that's one possibility. The other possibility, which it sounds like it could be, is just sitting at a screen for a while, you start to have like those kind of postural issues where your neck starts to get a bit tight, and neck tightness can lead to, cognitive problems and that type of thing. And that also correlates with the headaches around the eyes the next day. It could be a visual tracking issue as well. So there's a bunch of different things that it could be. With your screens, have you tried using like different types of screens or filters or anything like that?
So I've done some filter testing at my visual therapy, and everything they've shown me makes it worse.
What have they shown you? What do you mean?
So we did I don't remember the technical name, but color filters. So where they were testing different shades
Right.
to see if that, improved anything.
Right.
But the thing about me is because I don't get the headache until I, reach that 2.5 hour limit. When they when they showed me the colors, it induces like discomfort and actually like nausea sometimes and headaches. I don't know if that gives you information. So
Yeah, so it might not be a color issue, but typically screens will like refresh at a rate of like 60 hertz, which means the screen is flashing at you 60 times every second. It's just like this flicker that you can't perceive. What some people find helpful is having a screen that has a faster refresh rate, so 120 hertz, which is usually like kind of gaming type computer systems that have these faster refresh rates. Sometimes because it's so fast, it's like imperceivable to your brain, and it's actually more calming, so you can tolerate longer time sometimes with a faster refresh rate on your screen. So that could be something you might want to try. However, these things can be expensive. Just because they're like more high powered, whatever. There's ones from it's like BENQ. I don't know if you pronounce it bank or what, but BENQ is like a type of screen, and you can get secondary screens. Like I have 3 monitors set up in front of me right now. That's why I'm always looking this way because my screens are all beside me. So that might be something to try, is getting like just an external monitor that has a faster refresh rate and using that monitor attached to a laptop or whatever. That could be potentially helpful. The other thing to consider too is just sitting for the 2 hours, right? Like it might just be postural, like just after sitting for 2 hours, your eyes are darting back and forth. It's engaging your neck. And if you have neck dysfunction, that can start to be the issue. And especially kind of headaches around the eyes is usually related to like a suboccipital issue, which tells me there's probably some upper neck dysfunction.
I've been told I still have the dysfunction, but usually when I have the work done, they're like, okay, everything feels good. And then it's just always this threshold that I have that once I hit it, then the headache is induced. So even, just for background.
Right. Yeah. So it still could be that there's a neck issue. I mean, a lot of times people will go to somebody and they'll be like, "Oh, yeah, your neck feels fine." And then I'll see them and I'll be like, "No, it is not." So it just depends on the practitioner. Like, you may want to just try different ones.
Yeah, I'm about to go to a place that I'm really hopeful about.
Yeah. So that's good. I don't think they need concussion knowledge. I think that was your concern, is that they don't deal with concussions, but really it's like you need somebody who's just really good with necks,
Mm-hmm.
like treating a lot of headache disorder type situations. Acupuncture can be helpful in some cases. In some cases, it doesn't really do much, so you can try it, but I wouldn't necessarily be thinking that's going to be some sort of, um, you know, major thing unless it is. And so I think it's just worth a shot. Um, yeah, I mean, it sounds like you're doing all the right things. You may just want to consider just setting a timer. Right, like, just be diligent in terms of setting a timer so that you can have that break and not surpass that threshold, right? Because if it is, let's say, mild autonomic, you may just be exceeding your threshold in once you go over that 2.5 hours, and so if you just try to be diligent on that, time limit, and do that for a few weeks, and then just try to increase the time that you're there, but
Yeah.
gradually, right? Like, don't just sit down and go, and all of a sudden it's 3.5 hours, and you're like, "Oh, shit." But if okay, I'm gonna set my timer for, you said 2.5 hours?
Yeah.
Yeah, so set your timer for, like, even earlier, 2 hours and 20 minutes.
Mm-hmm.
Stay there and be diligent on it. Make sure you take that break, every, 2 hours and 20 minutes. Do that for, like, 2 to 3 weeks, being diligent on it, and then just increase it now from 2 hours, 20 minutes to 2.5 hours, and then do that for 2 to 3 weeks, and then go 2 hours and 40 minutes, right? So you're not really blowing over it tremendously, you're just going up by, like, 10 extra minutes,
Yeah.
and just by adding these, and stay there for 2 to 3 weeks, and then add another 10 minutes. And these gradual, just incremental increases, I think, will be more tolerable rather than like blowing your threshold by half an hour all at once and being like, oh shit. Um, so that might be just something to try in the meantime, as you continue to work on neck, continue to work on exercise, continue to work on all the other pieces of that. Are you tracking sleep? Because sleep is another big one for fatigue.
I'm not tracking sleep, but it's interesting you say that because I'm staying at a friend's place right now, dog sitting, and my
Mm.
sleep has not been as good. And oh yeah, okay, so that could
Yeah.
be.
So I mean, like I have an Aura ring. They can be, they're fairly expensive, but they're really great. Like, just for understanding your sleep and the things that impact your sleep. Um they're awesome for just being able to track, like, not just the quantity of sleep, but the quality of the sleep, right? And
Mm,
then you can implement certain changes and see how the quality of your sleep improves or diminishes, and then kind of what to do to just optimize your sleep, which I think is a
okay.
big one for this. Yeah. It's crazy how it impacts it. Like, here's just like a personal example of this is I have my Aura ring, and every morning I do Wim Hof breathing, right? Where you do like a hyperventilation basically for 40 breaths, and then you go into a breath hold where you hold your breath for as long as you can. And I notice a direct correlation between how good my sleep was and how long I can hold my breath for. So
Mm,
last night I had a good sleep. My sleep score was like 95. I had 8 hours and 40 minutes of sleep, which is really good for me. And I was able to hold my breath in each of those breath holds for like 2 minutes and 30 seconds. If I have a night where like my sleep is like, let's say, 7 hours, and let's say my kids woke me up or whatever in the night, and I was up for a bit, my breath hold will be like 2 minutes. So it like dramatically drops depending on how much sleep I get. And I don't know if that's just an inflammation thing where my lung capacity is different. But it's crazy how that impacts your whole systemic situation with a change in your sleep. Right. So just being able to even kind of make note of that is like, okay, I had a bad sleep. And then you might think, okay, my capacity is lower today because my sleep was bad. And that's, and then, or my capacity is great today because my sleep was good. You can kind of see how things are correlated. So it is a
okay.
helpful thing to have. Um,
Okay. And uh, just a quick question. So like this like headache hangover that I call it that I have today, I haven't had one of these in a while. I think I'm gonna probably go to the chiropractor I've been going to, who's really great. He just doesn't know what to do about the headache, or continuous headaches. But do you think that would be? I mean, I don't know if you can answer this question, but I'm thinking, okay, great. I'll go to him and see if any work I get done will help alleviate this a little bit. I don't know if you have any other suggestions, but
Yeah, I think that's a good idea. But also you got to think like, okay, if my sleep has been not great, that's going to make you feel kind of like groggy and hungover anyway,
yeah,
right? So it could be the fact that you've had not great sleeps that is causing this kind of, hangover, hazy, foggy, pressure feeling, right? Because sleep is how we clear inflammation, and if there's inflammation there, you're going to kind of feel that, right? Um, It's the same thing when you have a little bit of alcohol, your sleep is screwed up and then you feel gross the next day. Um, so it could just be related to sleep paired with, kind of some neck dysfunction. Um, and yeah, I think going to the chiro is great, but I think, take it easy for today because you kind of don't feel great. That's fine. Right? Like the Aura Ring tells me, they're like, "Hey, you've had a crap sleep. Take it easy today." Like it'll lower my exercise, like my activity threshold to say, okay, we're going to lower your activity threshold today. So just take it easy. And that's fine. That's okay.
okay. Yeah, super helpful. Thank you so much for covering all the bases, because I think it's just that the more I hear, the more I hear this, and I haven't spoken to you guys in a while, it's a really good reminder for all of these things. So I
Yeah.
appreciate it. Thank you so much.
You're welcome. All right. Next up is,
Hello, this is for mostly Dr. Hrkal. So I've had like extreme GI issues ever since my PCS symptoms have like been flared up to the point where I can only eat like 5 foods, safe foods. And my doctor is suspecting mast cell activation syndrome and putting me on cromolyn sodium. I was just wondering your thoughts on, could a concussion activate this?
The short answer is yes, it is possible. Yeah, it is possible. Mast cell activation syndrome, like a lot of these syndromes, they have multiple factors that kind of contribute to the genesis, the start, the initiation. And sometimes a concussion is like that one final piece that kind of pushes the nervous system into a state of hypervigilance, and now it manifests as being overreactive to any sort of histamine reaction and creating an excess histamine reaction. To get mast cell activation, you do need proper evaluation and testing. So you can actually test for histamine levels in the bloodstream. There's a couple other markers that are a little bit more complex that I won't list here, but those are things that should be tested. Have those been done?
I actually have blood work set up to get the test for the mast cell, and I'm seeing an allergist not until March, which is unfortunate. So it's in the works. It just, she suspects it, so she's just, why not give it a shot?
Yeah, part of the approach is cromolyn and a couple other antihistamines. So, I mean, usually it's a combination approach. Then, from a dietary perspective, I don't know exactly what foods you're avoiding or what you can tolerate, but there are foods that are higher in histamine or will cause a more higher liberation of histamine in the body.
Mhm.
Have you tried implementing that?
The foods that I can eat right now are like zucchini, bananas, white rice with a bunch of herbs and stuff. Everything else activates everything. I'm also on hydroxyzine as well.
And that's a very limited diet.
Yeah, I know.
Probably will lead to a lot of deficiencies if you can't eat anything else. Are you trying to mitigate that with some supplementation?
Yeah, I have a bunch of nutritional yeast in my food because I am a vegan. Also, I have been tested for vitamin deficiencies, and they're actually good. I don't have any B12 deficiencies or anything like that, so that's good.
That's good. I mean, yeah. So obviously you have to first do the evaluation, see if that's the case. You can try some of the medications. Being a vegan doesn't dramatically limit the foods you can eat. Obviously, more pickled things and even cured meats, which you don't eat, but they do have higher levels of histamine, but fresh meat does not. And sometimes it's quite hypoallergenic and nutritionally dense. Would you, I mean, this is another conversation now with your doctor, but that might open the playbook a little bit more on what you could actually eat. Because usually, whenever we do like a hypoallergenic diet or a diet that generally is well tolerated, there is some sort of either fish or chicken as a protein that's involved, because it doesn't give you a little bit more well-rounded. Like you basically need the amino acids. It's not just the fact of the deficiencies. That's definitely one thing, but then there's things like choline and zinc and amino acids that's more of the problem in the long term. Your body's immune system doesn't have those basic building blocks.
Okay.
Yeah. So I mean that the vegan problem is a real big one in my opinion, that could over time really continue to exacerbate an inflammatory response and impair the ability for you to heal and recover on a tissue level.
Okay.
So anyways, something to think about. If you really wanted to stick with the veganism, you could definitely look at protein supplementation. That's hit and miss on what you are going to be able to tolerate. So that would actually have to be a protein powder, right?
Okay. Well, thank you.
Oh, you're welcome. Good luck. It's challenging to handle the mast cell activation piece, but it's not impossible. So,
okay.
See what you can do.
Thank you.
You're welcome. Okay. Next in line.
I think my question is for Dr. Kem. I'm dealing with a lot of dizziness problem lately. I have actually I ended up in the hospital last week because my vestibular system shut down while I was driving. So I could luckily park the car immediately, but they kept me to do some research in the hospital, but it's still a bit unclear. And I'm puzzling what's going on. I feel like there's something going on in the triangle of vision, neck, and the dizziness. I have problems with when I have to switch from looking far to looking close by and back. Then if I do that for a long period, there will be dizziness later on, like it's like a delayed dizziness. And the same as with, I have glasses now for the screen. Then I get a little bit off when I use them, and I get eye strain, and they have been tested by 3 different opticians. So they should be the right, They should be the right ones. And also when I look down, I get a little bit off. So that's one thing going on. And the other thing is when there's too many leaves or stones or the chessboard exercise. I tried that for 4 times now, and I cannot handle it. And I was on holiday 3 weeks ago, and there were a lot of stones on the way. And we went somewhere where there are not so many trees because of all the leaves, but there were many stones. So I get tired because of it, and then at night, so nothing happens at daytime, but at night when I lay down, I get dizzy, and this time it was in the morning. It's very dizzy, and I had to vomit and things like that. So they checked with the Epley movement if it's maybe one of the crystals in the vestibular system, but it's checked for 4 times now, and there's no sign of that. So I don't really know what's the right thing to do to get over this. And maybe it's still the neck, but I've been working on that for like 5 months now. Yeah. And at the moment, the whole system is, of course, when I was in the hospital, the whole system was a bit, over-exaggerated. So I'm back on grounding exercises and mindfulness and walks now, because I'm back home now for a week. And I hope you have some advice for me.
Can you describe the dizziness?
There are different At night, it's just like I wake up and I have like 2 spins and then it stops. And sometimes the last month, 2 times it just kept on spinning. So I thought that's the spinning dizziness, and I had to vomit. And then it takes a couple of hours and then it's gone. When it's with the screen, it's even now when I'm in the session, it's like a little that I'm a bit off, that the things are shifting, like it's like I don't know even how to describe. It's not spinning. It's just that things are like a little bit to the left or a little bit to the right, moving.
Right. And when you were driving, what was that like?
That was totally dizzy then. So more like the spinning dizziness, but
Okay.
not spinning, but very dizzy. Everything was moving at that point.
Okay. So when things are spinning, that's like vestibular. And especially when you're lying down, like if it is positionally related, like you notice it when you're lying down. Do you notice it worse on like when you're lying on your right side, your left side, or on your back?
I thought that at one point that it's maybe when I turn in bed that it's happening, but I was on the couch now and it was just laying completely still when it happened.
So it doesn't happen every time you're lying down, just every once in a while it'll do it.
The last weeks it was almost every night, but yeah, now yesterday, last night it was not there, so it's up and down.
Have you had any recent infections, cold? Have you had a cold,
No,
sinus pressure,
no,
nothing like that?
no.
Do you notice that it's related to noise, like when you're talking or hearing things?
No, I think it's related with the eyes somehow. When there's a lot of images on daytime, that at night, I don't know.
Yeah, so that to me sounds like there's like a visual vestibular mismatch situation, like when you're having like there's a lot of like kind of visual motion or, patterns and things like that. Like those can be tricky. Um, but the lying down, like when you have the spinning, that's like basically purely vestibular related. That's not neck. Like when you're having the spinning sensation, that's more so related to something with the vestibular system itself. The spinning is.
Okay.
So it still could be something like a BPPV, but most people will check because 80% of BPPV is going to be the posterior canal, and the posterior canal is what you would test with the Epley maneuver. But in 10 to 15% of cases, it can be the horizontal canal, which not many people check.
It has been checked because we had the contact over the newsfeed because of that. So this is checked. All the different canals are checked by my PT after we had contact about this.
Oh, they did. Okay, they checked it.
Yeah.
Okay.
Yeah.
There's other types of testing that you can do from a vestibular perspective. Like, have they done it with the goggles? Like, have they done the Epley maneuver with the goggles on?
No.
Because you may need to do that because sometimes you can suppress it, right? So in these cases where it's kind of more subtle, that it's not showing up directly, sometimes you need to get the testing done wearing like infrared goggles because people can suppress their nystagmus response by just focusing on a point in the room. And so you put the goggles on, which puts you kind of in complete darkness, so you have nothing you can fixate your eyes on. And then that will help to pick up more subtle cases of dizziness. Do you have any like vestibular specialized physios in your area? Because they will have like these goggles to test. Like a general PT probably wouldn't, but somebody that specializes in vestibular disorders would have these goggles.
Okay. I'll have to figure it out.
Yeah. Now, the other thing too is like, oh, when you look down or when you look in different ways, that could be neck related. that subtle sense of just kind of things feel off, or that they're shifting slightly, or they're kind of moving around a little bit, that tends to be more neck in my experience,
Mm-hmm.
right? So in terms of neck treatment, are they doing work like in all the areas of your neck, or are they focusing just on like suboccipitals, which a lot of people do?
Well, my PT has been done a course with you some years ago, and he started with neck work, and then we went to proprioception exercises, and then to rehab.
Mm-hmm.
So it's only in the first 2 months, I think, that he did a lot on the occipitals and the other
Well,
stuff.
it sounds like you might still need more manual therapy,
Okay.
but is he working in the front of your neck?
No, at the back.
Yeah. So that's the problem, is that most people don't work on the front of the neck, and the front of the neck is like so big for this stuff, especially with things like looking up and looking down. The deep neck flexors are huge for this, and they're like right in the front by your trachea.
Oh,
You have to kind of push it out of the way and get into the deep neck flexors and work on that area. SCM, scalenes, which are on the sides. That type of stuff is like super important for these dizziness cases.
okay.
Like I treat them on every single one of my patients. So I would suggest that you probably need more manual therapy.
Mm-hmm.
In addition to, right? Like I never stop my manual therapy. I just start adding in the next pieces with it, but I continue always doing the manual therapy. It's not like I do manual therapy, then I stop, then I do proprioception, and then I stop, and then I do this. It's like you're adding the layers to it. So I'll
Okay.
always do manual therapy. Then when you're at a point where then I'll do manual therapy and then do some proprioceptive exercises after I'm done my manual therapy. Then I'll move to doing manual therapy, proprioceptive, and stability all kind of together, right? You don't want to stop one and move to the next. You're always kind of doing them, but you're just adding the pieces on as things improve.
Yeah, that sounds
So I
good.
would say from that type of like subtle, like things are just kind of shifting and moving, or even the visual stuff like the leaves and the rocks and stuff, a lot of that is kind of neck related. It could also be visual related. But with the spinning, that still points to something vestibular related, and you may have like a subtle BPPV where you need the goggles to test it.
Yeah. Yeah, from the vestibular system on the right side is not functioning well. So it's only functioning for 15%.
Right. So you have a hypofunction. So that can cause what you experienced in the car. That can cause these other issues too. So the treatment for that is vestibular physio, but you need somebody who's probably more specialized in vestibular physio that can test you with the goggles. Like, who told you that you have only 15% function?
They did research in the hospital almost 1.5 years ago.
Okay. And did they put goggles on you, or did they do like caloric testing or something like that?
They did with warm and cold water in the
Right.
air,
Right.
and
Right. Okay.
there was goggles and like stripes moving.
Yes. Yes. Yeah. So like an optokinetic type reflex. So I would try to find a vestibular physio
Okay.
specialized in vestibular issues. So try to
Okay.
do some searching around that. Because then they'll be able to give you rehab for that vestibular issue, right? Because vestibular is like a specialized field. So you can't just go to like general PT. I think that your issue needs like specialized vestibular physio. But then I would keep going to the other PT for the manual therapy in the neck, and I would just encourage them to get back into the manual therapy as well and working on the front
Yeah.
of the neck,
Yeah.
right?
And can the jaw also be in
Yes.
there as well as a
Yes.
flex
Yeah,
also?
like jaw and neck go hand in hand. So I always treat jaw on everyone with neck issues,
Yeah. Okay.
right?
I'll ask him.
So I would try to get some TMJ and neck manual therapy in addition to the rehab exercises you're doing. I would try to find a specialized vestibular PT to work on the other pieces of that. And
Yeah.
I think that'll help bring it together.
I hope so, because when the first time, 1.5 years ago, when I was also in the hospital with all this stuff, they sent me to a specialized PT. So I've done like 3 months of vestibular rehab. but that was before I was in this program. So before any grounding or mindfulness. So do you think I have to redo that?
Redo what?
Redo the vestibular rehab.
Yeah, and I think it'll probably go better because you've built a better foundation.
Yeah, okay.
Right?
Yeah.
So I think that's where people go wrong, is that they've like, well, I've done vestibular PT, but they did it early on before they had like fixed autonomic and all these other issues. And so I think that having done that will make it more likely that you'll be successful with another round of vestibular PT in addition to the neck work you're getting.
Yeah. Okay.
Right. Because that's the other thing. You do vestibular PT by itself and there's neck dysfunction, it may not be as effective. But if you're also incorporating the manual therapy of the neck and you're doing vestibular PT simultaneously, plus you've had all the other things that you're doing as part of this program, I think that'll start to just add a lot better than it would on its own.
Okay. Yeah. Thanks a lot for this.
You're welcome. Okay, next up is...
Hi guys, how you going?
Good, how are you?
I'm the one that posted the hamster wheel discussion board. I think you replied a couple of comments on that, Cam, which were good. Said to jump on this, but just a bit of background as well. So I think 6 months post-injury, and then have been on your program for about 3 now. Been on the diet for a couple. I've checked my hormones, which are good at the moment. And then the vestibular issues, I had some early on, but I did treatment for that over the course of the journey and have kind of more seemingly kind of fixed that side of things. Now probably the kicker here, which will be a little bit maybe you and maybe a bit as Mel as well, but yeah, I've got a history of anxiety for probably about 15 years. I've been on escitalopram for about 6, and the concussion has quite literally rolled my nervous system. Which I've come to learn over the course of quite a few flare cycles, probably 6 or 7 flare cycles in the last 4 months. So I was kind of stuck in that cycle where I was kind of feeling better, starting to add things in, and then I don't know, having a stressor at work that would tip me over the edge, but it was like a seemingly trivial stressor that just got stuck in my mind, and then I couldn't snap out of it really, and then I'd get fatigue, brain fog, and then just kind of spiral from there a little bit. So that's why I stopped work 2 months ago now. I had a really good run up for 6 weeks previously. I was doing the Buffalo treadmill test with my physio to get to a heart rate of 154. And I'd kind of taken all the stresses out of my life, but then probably hadn't really considered maybe the nervous system stress of doing things socially, and kind of did one a week and a bit ago now, noticed that I was feeling crap on the Sunday. This has happened on the Saturday, and then Monday, Tuesday I decided to rest. Wednesday I decided to rebuild again. So that was like a heart rate of 110, and then I went to 115 on the Thursday, and it just rolled me. And then I mentally kind of spiraled off the back of that. But then I guess, I don't know, I just kind of wanted to hear from you guys. Like, I kind of feel like, I know I said it in the thing, but I feel like I'm losing hope a little bit, because I've almost convinced myself that, like, every time I get a flare, I go back to the start, which is kind of, well, I know that's not necessarily should be the case, but it's kind of what my experience tells me in the last 6 or 7 instances. So, yeah, I'm now doing a lot of mindfulness stuff, like meditating for an hour and a half a day, doing breathing exercises over the course of the day, pretty strict on just like energy accounting, that kind of stuff, and how much I'm kind of exposing myself to certain things and kind of gradually building that. But I realize now that flares are going to continue to happen and will happen. It's just how I deal with the next one that I'm hoping to get a bit of advice on.
Yeah, I'll start, and then maybe Melinda can go. So I've talked about this before, but you kind of got to look at recovery as like the stock market. You kind of go up, and then there's a pullback, and then you go up, and then there's a pullback, and then you go up, and then there's a pullback. And so there's always these like pullbacks along the way, but it's how we respond to those pullbacks that really makes the difference. And a lot of our response to it, especially when you have, kind of pre-existing anxiety and mental health issues, And just that kind of thinking where you're starting to kind of lose hope or you're getting discouraged by it, that type of stuff is what can cause like a, 10% pullback turns it into a 30 to 40% pullback, right? Like, why do these big market crashes happen? Well, it's because people panic, right? Oh no, and then everyone sells, and then now you're turning a 10% pullback into a 50% pullback, right? You have this big crash. So it's really being able to kind of shift your mindset around it to say like pullbacks are normal, and just try to find a reset, try not to catastrophize the situation, because that's when things start to get even worse, right? And then it's kind of a self-fulfilling prophecy, right? If every time this happens, I end up with a 50% back down to my starting point, now I got to start over, then that is what sticks in your mind, and then you convince yourself that that's the reality. And then every time it starts to happen, you go, oh no, oh no, oh no, oh no. And then I'm spiraling, and oh shit, I'm going to be back to square one. And next thing you know, you're back to square one because of how you're kind of internalizing that.
Yeah, I think previously I was obviously at work, and then there was pressure. Like I'd done multiple return to work plans to try and get back as well, and then I was just realizing that I wasn't getting any better with work at the same time. So um, yeah, and I kind of just still wanted to get like there's pressure in my mind to get back to work as soon as possible as well, because you don't really want to like lose your job and you've got commitments to them as well. So um, yeah, I don't know. I just kind of obviously wanted to hear from your perspective, like how far you kind of should go back when you have a flare, and maybe coming off the back end of it, because like I'm thinking like 2 days kind of rest with a lot of mindfulness, and then like it's that rebuild that probably gets me, because like coming out the other side, you think you're good, and then you hit a wall, and you're like, oh shit, then I'm bad, and then I spiral.
Right. So everyone's kind of different, and every
Yeah,
setback is kind of different. So it's hard to say, like, it's hard to give you like a hard and fast rule that if there's a pullback, you pull back by 20%. And then, like it's hard to say that because everyone is kind of different. It depends on the situation. So I think that really anytime there is this kind of flare, it's trying to like just calm things down as much as possible and not get into that kind of rumination mindset where you're starting to spiral from a mental health perspective. And that really comes down to building those tools when you're feeling good. A lot of times what happens is when we're starting to feel better and better and better, we stop working on all that stuff.
yeah, I've noticed that.
And because we've stopped working on all that stuff, those tools are not there to call upon when we need them. And you'll never be able to build a skill in a dysregulated state. You have to kind of get out of that dysregulated state and then build that skill so that you can call upon it and have the confidence to call upon it when you need it. And so I think that's like a big component, is being diligent on the kind of mental health side of things, even when things are going well, so that you can call upon those tools. Are you seeing anyone like, are you doing any like,
Yeah, no, I've been seeing a psych for a couple of months now, so I'm doing a lot of work on that side of it, and I probably hadn't done enough probably on the mindfulness side of things, which I've gone back over Melinda's sessions as well, and then I'm using the Waking Up podcast. I mean, not podcast, but Waking Up app as well,
yeah,
which I've found really good.
yeah, it's awesome.
I'm also curious as well on the exercise side of things. Like previously, exercise was a vice for me, and I was seriously active, and now I don't know, back to walking, and I haven't run in 4 months without symptoms. So, or 5 months without symptoms. It's like obviously your scale on autonomic dysregulation. I think you got POTS at one end, and then exercise intolerance, and then just anxiety and mental health and whatnot. Like I assume as you build up that exercise tolerance, your ability to deal with external stresses is greater before you kind of get tipped over that edge. Because like in my mind, I'm like, oh my God, if I get back to running again, like I won't be tipped over by like the slightest inconvenience in my life or something trivial again.
Yeah, and it's all the systems working together, right? So it depends on how much that stress affects you. So you might be like able to exercise fully, but like something that tips you off from like an anxiety perspective or a mental health perspective can actually cause a spiral that will now start to impact the exercise tolerance, right? So yes, it's helpful. But it's everything together, right? So it's kind of, you're describing almost like the concussion cliff scenario, right? You get yourself up to the edge of the cliff and you think everything's going well, and then a stressor just pushes you off the edge, and now you feel like you're starting back over to climb up that cliff, right? So it's about trying to get up to the top of that cliff and then keep kind of getting yourself away from the edge on all respects, so that stressor comes along and it doesn't bother you. So and I think that obviously comes down to, your mental health, where you're at, your exercise levels, your, the diet, everything else. And even things like running might be flaring your symptoms because of neck issues or visual issues. It may have nothing to do with autonomic, right? So it's making sure those pieces are also kind of being taken care of as well. So I think that when a flare happens, you kind of just do like a reset. Like there's got to be kind of a bit of a reset plan. And the way that we usually describe it is like, okay, take a couple days off. Don't stress about the fact that you're not exercising today or whatever like that. Try to get outside and get some movement, right? You want to still get like sunlight during the morning to optimize your sleep. You want to still go for like a nice light walk, but just don't worry about your heart rate thresholds. You want to have some.
Yeah, I can usually get a walk in and be okay.
Right. You could do like a walking meditation as you do it, like something to just kind of help yourself out. Double down on diet, right? Optimize and prioritize sleep and work on those mental health strategies to just try and prevent the bottom from falling out, right? Try to not be ruminating on things. Easier said than done, obviously. But then when you go back to exercise, so you started at 100, then you went to 110, then you went to 115, and that really rolled you. Okay, fine. So 115 is too much right now. Go to 110. Do that for a week and then go back to 115. The buildup is actually quite quick once you've already been at 154, right? But if you start to say, oh man, I can't even do 115 now that's just adding an additional stressor to you. And that's not going to be very helpful for you. You just go, okay, I'm at 110 now. Like, that's just where I am. And I'm going to do that for a week. And then now I'm doing 115. And then next thing you know, you're back up to 150, but you've done it in a gradual way and you're there. Next time you might be able to get all the way to 130 before you actually have that setback. And then now, okay, 130 is my level and that's fine. And I'm just going to build myself back up. So again, it's just, right? Recovery is never linear. It's kind of up and down and up and down and up and down, but just overall, you kind of just want that trend to just maintain that upward trajectory and do things to support yourself when you do have a pullback so that you don't spiral out of control and make it a 50% drop. It's only a 10% drop. So I'll hand it over to Melinda because I'm sure she has a lot to say about this from a mental health perspective, but I know it's hard to trying to not lose hope. Right?
It is a lot easier said than done.
It is. It's 100%. It is. This, like we always say this, that concussion recovery is going to be the hardest thing you ever do. But from that, you're going to be a stronger person moving forward because everything else in your life beyond this and when you recover from this is going to be nothing because you've had to do this, which I think is like so powerful for people, right? Like the adversity that you face is going to be a strength for you when you're out of this. And right now you're in it and it feels like you'll never get out, but you will and you can. And it's going to take some work and you're just going to just one day at a time, one step at a time. Don't be in a rush to get back to work. Don't add that stress to yourself. Right now we're in recovery mode and it may take 4 or 5 months before you can even consider a return to work plan. And then when you do that return to work plan, it's very gradual, very slow to build that tolerance up and give yourself the confidence over time that you can do it and you can add a next hour and add a next hour and a next hour. But you're doing that in such a gradual way that you're not going to set yourself back and have to leave again.
Yep. Thank you.
You're welcome. Melinda.
What I'm hearing is just the sense of maybe needing to adjust expectations. So when we have an expectation of sort of like how things should go in an upward trajectory without having setbacks, then we've already set ourselves up to sort of suffer with a setback once it happens. So in the recovery mindset section, we talk a lot about adjusting expectations for recovery. So it might be kind of revisiting that module for a while, sort of like living there, listening to some of the things. There's a video there that talks about the farmer and his horse. I don't know if you remember that. It's talks about the power of maybe and not always having a expectation on, how things need to go. It's almost like building a new skill, right? There's a lot of expectations and responsibilities on us in our day-to-day lives, but once we have an injury that's taking a while to recover from, or our body's at a balance, it becomes difficult to keep up with those responsibilities, requiring us to sort of step back and, maybe not go back to work as soon as we had hoped, et cetera, et cetera. But when we add to our suffering, it's because our mindset hasn't caught up to where we are and what our struggles are. So if we're sort of constantly putting pressure on ourselves to get back to work, or feeling that pressure of other people telling us to go back to work, or questioning why we're not better, then it's likely we're going to spiral further when we do have a setback. So oftentimes that sort of like growth mindset invites us to sort of look at recovery as, this is happening. Maybe some days are not great, other days I'm getting better, but that doesn't mean I expect every day to keep getting better from here on in, right? It's going to be an up and down journey. So if we can rationally set our expectations on what concussion recovery looks like, then oftentimes we're not adding to our suffering anymore. So this is outlined in so much detail in the recovery mindset. There's also a book that I recommend called Mind Over Mood that really helps us learn how to manage expectations, as well as recognize periods or thought patterns that can be unhelpful for recovery. So I think you've shared that with me and shared that with us here, that when there is a setback, then you spiral. So what that tells you is there's expectations there, right? There's an expectation of how things should go, that it's not okay to have a setback. So almost that sense of like reframing that setbacks are part of concussion recovery. It doesn't necessarily mean that's a bad thing. It means you're touching in on something that still needs some TLC, that still needs a little bit more care or treatment. So that's kind of the invitation that I would add to what Dr. Cam said is, can you build expectations that are more rational for where you are right now? So if a setback does occur, it's like, oh, okay, what is this trying to show me? Like what, underlying system potentially is still disrupted that I need to focus my attention on? How can I remove other demands in my life in order to make room to accommodate the extra need that my body has right now? So I don't know if that's helpful, but that's kind of...
No, that was good. I think Nikki's just posted the episode, or the module, sorry, that you did, the power of maybe, and I'll grab that book as well. I'm also conscious of time that I think I've taken up, and there's still two people behind me as well, so I will jump off. But thank you very much, guys, for that. It was really good.
Thanks.
All right, next up is
so my question is a little bit related to the visual part. I'm 2 months out of my concussion, so it's quite recent, I guess, compared to some others. But I'm just noticing the vision is playing a role, and I always thought the neck was the main issue, so I was mostly focusing on that. But now I notice with the vision that it's things, for example, further away. I have difficulty getting into focus. And also mental imagery is more difficult. Actually, I have a hard time focusing on mental imagery. That made me think, okay, maybe it's more vision related. And I'm getting my neck checked out next week, actually, by a manual therapist. So I want to see if that's going well. And I'm just wondering, is it smart to start adding in a vision related rehab? And even, would you even recommend, even at this point, even going to a neurooptometrist or anything? Or is this something that's way further down the line, or I take the course, I'm relatively at the beginning still, pace myself, and maybe in 2 months start adding in that when I'm at the full rehab section?
So typically, I think the way to do this is to do the foundational stuff first before anything. Like if you look at our recovery pyramid, maybe I'll just pull it up so that I can talk through it. Whoops, let me just find it here. Let's do the complex one. All right. Share. All right. All right. So here's our concussion recovery pyramid, right? So this is the order in which things should be done. So first is kind of understanding what's going on, right? So that's at the early part. Then it's the mindset piece from Melinda, all of that stuff. Then it's regulating the nervous system. Then it's optimizing sleep. Then it's talking about, gut brain microbiome and neuroinflammation. Then it's diet and nutrients. Then it's hormones. Then it's exercise. Then it's neck. Then it's visual vestibular. So visual vestibular is typically the last thing. So if your issue, for example, is neck and the neck is causing the visual issues, then doing neck work will get rid of the visual issues and you won't need to do vision therapy.
Mhm.
Right? So I think, given that you're early, I think a lot of this stuff will probably help with the symptoms that you're experiencing. But if you wanted to start in with a little bit of neck work, that's fine. But I would see where that goes first, personally. Because if that neck work gets rid of the vision issues, then you've just saved yourself thousands of dollars in vision therapy that you didn't necessarily need. If the neck doesn't get rid of the visual issues, then you might want to consider visual rehab. Does that make sense?
Yeah, that makes sense.
Yeah.
Okay, so you're saying indeed more so take my time through the program, if it might even take me 2 months in a sense to get to that point, rather to take it slow than to add in any vision related, even like at home rehab in a sense, just because the foundation is more
Yeah,
important
and we
than
have
starting over.
like when you get to this portion of the program, we have kind of
Yeah.
self-assessments in there.
Mm-hmm.
Right? To say, okay, what does this do to you? If that's a problem, then here's the exercises you can start doing as kind of some basic things. And
Yeah.
then that works often for most people. Right? If it doesn't, then okay, now you would go on to the next step, which would actually be trying to find a vision therapist. Now it depends on what your symptoms are. Like
Mm.
if you like, what are if your only symptoms are kind of these visual issues, but everything else is fine, then you can probably incorporate this stuff now.
Mm-hmm.
If you have a whole bunch of other symptoms and vision is just one piece of that, then I would be working through this first.
Right.
So
Yeah.
what's your situation?
Yeah, I guess, well, there is some autonomic, like the exercise intolerance is still there. I think my sleep is being really good. My diet before is being good, and I cleaned it up already now a lot and being very aware of things. So I think the middle portion is there. I think sometimes the nervous system dysregulation is off balance sometimes, like with the flares going back and forth. And then at the top, I think that's where it is a little bit. But I'm already doing sub-symptom threshold exercise, like based on the Buffalo protocol by myself,
Good.
which is going well, but it's taking time. So
That's okay. That's okay. As
yeah,
long as you're doing it and you're on that path, you don't have to conquer it before you move on.
no,
Right? It's just as long as you've like implemented it and you're doing it as part of your everyday and it's kind of your routine and you got it. Okay, good. Now you can add the next layer. And then you're just adding that piece on so that by the end you're doing everything together, but you don't want to add it all at once because that'll just be overwhelming. So we do it in a
right,
stepwise place. So you add this,
yeah,
once you kind of got that down, then you add the next piece, but you keep doing this. You never
yeah,
stop doing this, you just add the next piece. Then you keep doing
mm-hmm.
this and you add the next piece. Then you keep doing that and you add the next piece. So it's just adding pieces to your routine that eventually you're doing everything simultaneously because that's really how it works. But you can't just add it all at once. So as
No,
long as you're
exactly,
doing the sub-symptom threshold exercise and you're doing all these other things, that's good. Okay, yeah, I would start with neck and see if that gets rid of your visual problems. Because if it does, then
mm-hmm.
great, it was a neck issue all along. If it doesn't, then okay, maybe there's a vision component that needs to be addressed.
Right, yeah.
That
And
makes
I
sense.
was also wondering, like sometimes visual problems could kind of leave by themselves. I mean, I'm at 2 months now, so maybe it is even early in itself, but just like going through my life, walking through the program in the next 1 or 2 months, the visual disturbances would just naturally change, maybe. I don't know.
It depends on what's causing them,
Yeah,
right? It depends on what's causing them. But by doing all this other stuff, it'll optimize your response to vision therapy anyway. So it's
right.
still good to do all this other stuff,
Mm-hmm.
right? Because if you have like autonomic issues, for example, and you start doing vision therapy, that can send your autonomic system into a spiral if it's not ready for it.
Right.
So it's still good to have a good foundation before you start doing rehab because rehab is going to challenge your system. And if your system is well
Mm-hmm.
balanced, you're able to tolerate it. If your system is not well balanced, a lot of times it can really flare you up and make you kind of spiral down again.
Yeah.
So that's why the order is what it is because you want to make sure that you have a strong foundation before you start doing kind of the rehab things. That's why I asked, like, if your only symptom was visual and you had nothing else, then I would say, okay, you're potentially, you already have a strong foundation. It's just getting into the rehab now.
Yeah.
So I wouldn't necessarily like wait because you're only 2 months out. I would start in with the neck. You already have that plan. That's good. See where that goes over like 6 to 8 weeks as you continue with the rest of this stuff. And then if the vision problem is still there, then I would probably look for a vision assessment to see what else can be done from a visual perspective.
Right. Check. Sounds good. Thanks.
Okay. Yeah, no problem. Last up is.
Yes, I wanted to ask about noise sensitivity. I've had a concussion now for like almost a year and a half, and it has gotten better. At the beginning, like I could only go to a coffee shop like for 10 minutes, and then it was a problem. But now I've moved that up to about an hour and a half. But I went for one coffee shop, and just the sound of the machine beeping, and when I'm especially social situations, I'm all right with one or two people in a quiet environment. But as soon as there's more, I just get so dysregulated and have to, go up and rest and breathe. And then the next day, I basically can't do anything for the whole next day at all. Haven't been able to go back to work or anything like that. And the other thing is, even yesterday I was playing a bit with my grandchildren, and the other grandma was putting in some tiles. Well, I was only there 10 minutes, and I felt like, oh my goodness. So that too, and I've got the noise canceling headphones I wear, but I'm just wondering if there are any other ideas on how to gradually get myself better with noise.
So there's a few things to consider. Noise sensitivity, like one of the things that I think people make a mistake on is trying to avoid, right? So noise canceling headphones would be kind of an avoidance strategy. You actually become more sensitive to noise the more you avoid it. So there's actually research to show that people that wear sunglasses, for example, like they have light sensitivity after their concussion, doctors will often prescribe, okay, well, wear sunglasses, indoors. What happens is that people actually get more sensitive to light because they're shutting it out. So now regular light seems bright because you've been behind this filter. Same thing with noise. If you shut out the noise by wearing noise canceling headphones, you become more sensitive to noise.
Although I have been getting better. Like before, it was like I could only handle 15 minutes. Now I'm able to handle, an hour and a half before I'm shutting down completely. Mm-hmm. So, yes, I hear that. I'm not sure when to wear them and when not to wear them. Or not wear them at all.
Yeah, I think that one of the first things I do with my patients is I tell them to get rid of that. And I want them to just gradually increase their exposure, right? So right now, let's say you're at an hour and a half.
Yeah.
I would maximize your time at slightly less than that, right? Like if an hour and a half is when you start to feel it, right? Make it so that an hour and 15 minutes is when you're checking out.
Okay.
Right? So that you're staying within that window of tolerance. Then gradually increase that amount of time, right? Now try an hour and a half and see how you do. Keep it at an hour and a half for a bit, then move it to an hour and 45 minutes for a bit, and then move it to 2 hours for a bit. And then you just gradually increase your exposure. Now at the same time, right, where are you at in the program? How long have you been in the program?
I've been here since December last year, but really I didn't do anything with it until maybe the end of February.
Okay.
And I've gone through the modules. I've improved a lot, but I still am having, after the one time going out for Thanksgiving, that was 4 hours. I just had to rest and breathe. And then I got a bit better, and then I went out for a coffee, and I thought, well, that's no problem. I only stayed for an hour and a half, but I had another period where that was about a 3-hour recovery. So just like how, because I'm trying to avoid crashes, but it seems whenever I go out of my house, I'm having a crash.
Yeah. So the other piece to this, like sensitivities like that, are often related to dysregulation of the nervous system.
Yes.
Right? Because if you think about your nervous system, you have your sympathetic, which is your fight or flight. You have your parasympathetic, which is rest and digest. When you're in a sympathetic state, you become more sensitive to light and noise and stimulation because it's your body's protective mechanism because it's sensing danger. So you want to be able to see better, you want to be able to hear better in that danger situation. But when that's always on, it's uncomfortable because you're not actually in danger, but your body's perceiving that you are. So a lot of this comes down to like the nervous system regulation stuff. So to me, it just says that your nervous system is still dysregulated. So it's a two-part piece. It's doing the things in a safe space to regulate the nervous system so that your tolerance for noise and things improves. And even when you're in that situation where there is noise, having the skills to be able to calm your nervous system down at the time to give yourself more ability to tolerate it in the moment so that it doesn't create a crash. Because I think where the crash comes is that your nervous system is dysregulated. You go to this overstimulating environment, and after a while of that, your body is just like, and it just keeps getting
That's
worse.
exactly what happens.
And then all of a sudden now you hit the wall and you crash.
Yeah.
Right? So it's being able to like do the things that you learn how to do in a safe environment to regulate and calm the nervous system so that you have the skill set to be able to call upon that when you're in an environment. Because if you're, let's say, up here and you're in a very stimulating environment, things are getting up, but you have the skills to be like, and bring it back
I have
down.
those skills because at home, that's what I'm doing every 2 hours is breathing, humming, doing the tapping.
Mhm.
But when I go out, I have a feeling I stop doing most of it. The
Yeah.
conversation and the location somehow. I am drinking the water and electrolytes. That helps a bit, but yeah. How do you incorporate like?
Yeah, I would pair it. I would pair it with something regulating, one of your regulation activities that you find helpful right before you go out.
Yes.
Halfway through when you're out. So excuse yourself from wherever you are, take 5 or 10 minutes, do a regulation activity, and then again at the end. So you're pairing something regulating with something stimulating to help stay within your window of tolerance. Oftentimes we sort of forget about it when we're out, but it can be really helpful to also include it while you're socially engaged or when you're doing something that might bring on some of these symptoms.
Okay. And one other question I had, like, I live alone and I'm wondering, like, I have trouble handling music. And I'm just wondering if I should be trying, like, I almost would have to listen to spa music. Not that I like that, but some way of getting me used to it at home before I'm in an environment where I have the music and people talking.
Yeah, I mean, I think sort of all signs are pointing towards just having that sort of hyperarousal, that hypervigilance in your nervous system. So something like sound can be a real trigger for our nervous system to get overactivated. So I think starting out with finding ways to kind of bring that level of arousal and activity down in your nervous system before trying to expose yourself to these triggering experiences. If music is one of them, socializing is one of them. Oftentimes the like high energy stuff and social connection comes last. So I think the invitation is to come back, back step a little bit and work more on, how can I find my way back in my window when I get bumped out? So that's outlined really well in the regulating your nervous system section. You can use and pair some of the activities we suggest there, or the ones that you're already doing sounded helpful. Again, if you feel like you really want to be listening to music, I would pair it with a regulating activity first, then try 2 minutes of the music, then pause it, do another regulating activity, remind yourself that you're safe, and then gradually work your way up. So if we find that we're doing something that we used to be able to tolerate and we just try to like push through it, that signals our nervous system that we're unsafe and we're likely to get more symptoms and have that symptom flare.
Okay, thanks very much. Like, I used to love loud music. That's what's so strange about this.
When it just says that, hey, your nervous system just isn't ready for that yet. And it doesn't mean it won't come back and you can't really enjoy that loud music again. But right now, your nervous system's saying that is just too stimulating for me right now.
Okay, thank you very much. I'll try those things.
Sure, let us know how it goes.
Okay.
Great Q&A today. A lot of great questions. So thank you for everyone who did come on. So I hope everyone has a fantastic weekend. Bye.
Bye-bye.
Bye, everyone.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.